Hello and thank you for choosing CONDOR. Here are the steps to follow for an optimal use of your intraoral scanner. Before you begin, make sure the camera is plugged into a USB 3 port and the laptop is connected to the mains power supply. The simple yet comprehensive starter kit assists and supports you in your diagnoses and optical impressions. Insert the handpiece into the transparent protective sleeve, press the plastic film over the lenses and remove the self-adhesive film. Then clip on the scanning guide to maintain an average scan height of 10 mm. Launch your CONDOR software. From the home screen, click on New Patient. Fill in the new patient's information in the form. Click on New Work. Choose the scans to perform by clicking on Maxillary, Mandibular, or Bite. It's important to follow a specific scanning order. The most effective order begins with the entire occlusal surface, moving then to the buccal surface, and finishing with the lingual surface. Follow the instructions on the scanning screen. Black gloves should be worn for each scanning procedure to reduce light reflection. Hold your camera in the same way as a pen. Turn on your handpiece by holding down the on-off button for a few seconds. Before each scan, your patient's mouth should be prepared to avoid any rough texture, saliva, blood or other irregularities. Start the scan by quickly pressing down the on-off button. It's recommended to watch the screen during the scan. The screen is divided into two areas. The 2D area on the left shows what the camera is filming. The 3D area on the right displays the real-time 3D reconstruction. The square in the center of the 3D area indicates the acquisition status or tracking, and its color varies according to your acquisition. Green, the tracking is good. Yellow, the tracking may be lost. Slow down your scanning motion. Red, the tracking has been lost. Return to a known area. Conversely, a black area on the 3D reconstruction indicates a lack of information and asks you to concentrate on this area. You will sometimes need to stop your current scan. This allows you to study the missing areas to go back over. You have the choice to turn your model with the left click held down, move it with the right click held down, or zoom in or out using your mouse scroll wheel or right click on your laptop touchpad. Once the missing areas have been identified, click on Edit Scan. The 2D area is also colored to guide you. When it turns red, your camera is too close to the teeth. When it turns blue, your camera is too far away. The green dots displayed on the 3D reconstruction indicate that the information has been correctly recorded and ask you to continue. Once these green dots have been saved, go to the next zone. There is no need to return to the area already displayed. When your acquisition is complete, turn off your scanner by pressing the on-off button again. The STL and PLY files obtained are opened and compatible with all CAD or implant panning systems on the market and can be transferred to any conventional media. It's also possible to draw a finish line either manually or automatically. Once a scan is completed, the job is automatically saved without any action on your part. Once the mandibular scan has been created, you must carry on the same procedure for the maxillary and occlusion scans. CONDOR also acts as a diagnostic tool to help the patient adhere to the treatment plan. Communication is the most effective way of motivating the patient, helping them to accept the treatment plan and building their loyalty.